Palpation of the spleen. Perform hand washing before the contact with your patient. Provide privacy. Prepare all the equipment. Greet your patient warmly and politely. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient or family present. Manipulation can be performed with disposable non-sterile gloves when it can be risk of contact with biological fluid of your patient. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm, your hands should be warm, cut your nails before palpation. The couch is prepared. Seat of the chair is to the right side of the patient, for the right-handed doctor, to the left side for the left-handed doctor. The chair seat is at the level of the couch. The patient should lie on the right side with the left leg slightly bent at the knee and hip joints, and the left arm bent at the elbow joint. The abdominal muscles are relaxed. Breathing is superficial and calm and through the mouth before palpation. It is recommended to perform percussion of the spleen before palpation. The left hand is placed flat on the lower part of the chest, on the left costal arch, and slightly squeezes with area to limit the movement of the chest during the breathing. The distal phalanx of the second, third, fourth, and fifth fingers are located parallel to the anterior edge of the spleen. You're working with your right hand. 3 centimeters below the location of the spleen, which is found during percussion. During the patient's inhalation, form a skin fold, shifting your fingers of the right hand down towards the umbilicus. On exhalation, you have to form a pocket by pulling the skin down and placing the palpating fingers deep into the left hypochondrium during the exhalation. Ask the patient to take a deep breath, leaving the right hand the depths of the left hypochondrium, during which the fingers slightly unbend and make a slight upward movement toward the spleen. In the case of palpation of the spleen, its location in centimeters from the edge of the costal arch, consistency, shape, and paleness are noted. Assist dependent patient in dressing. Explain the data obtained during palpation. Perform hand hygiene. Discard disposable equipment. Record the procedure in medical record as required.